After decades of declining numbers, a new report from the American Cancer Society finds cases are increasing for women in their 30s and 40s. So we have NBC News medical contributor Dr. Natalie Azar here to help us understand what that means. Good morning to you.
Good morning, guys. Nice to see you.
So why the sudden uptick in slightly older women now?
Two topics for the discussion this morning. One is going to be about HPV, and the other one is going to be about cervical cancer screening. So HPV, a virus that is the most common cause of STIs in this country, is responsible for greater than 90% of cervical cancers. In 2006 was when Gardasil was first approved. That's the that's the HPV cancer vaccine, or HPV vaccine. That generation, in the women in their 20s and men as well, are really the first generation to benefit from that.
So it's working.
So it's working. And women in their 30s and 40s kind of missed the boat on that vaccine. In terms of cancer screening, according to the CDC, greater than 50% of women who were diagnosed with cervical cancer either had not been screened recently or ever, or in the last 5 years. So again, HPV and screening is what we really want to concentrate on this morning.
So with the HPV vaccine,
yes.
Who should be getting that?
So you can start as young as the age of 9. For boys and for girls. Around 11 to 12 is kind of ideal. Also, ideally before they become sexually active, but also after. Again, it's so common. So once you become sexually active, it's very likely that you very well might be infected with HPV. It doesn't necessarily mean you're going to develop cancer. But it is approved through the age of 45. So if you're above, usually we think of 9 to 26, but if you're above the age of 26 and you're potentially at risk, for example, some of my patients in rheumatology who are on immunosuppressive medicines, it's now a recommendation to actually get them vaccinated. If you're 9 and 14, it's 2 shots. Older than 14, it's a 3-shot series.
3 shots and that's it? Not for life, but for life.
Well, for life.
Yeah.
As far as we know.
Okay.
Right?
All right.
And what about for males?
Also important. We link HPV vaccine because it's so important in preventing cervical cancer, but HPV is responsible for over 70% of oral and throat cancers, and it's also responsible for other cancers, anal cancers and things like that. So men absolutely are at risk and absolutely can be vaccinated as well.
Well, for women, we talk so much about mammograms
Yes.
and getting screened. What about for cervical cancer?
So I feel like many years ago when the recommendation changed where you didn't need a pap smear every year, the people sort of said, oh, I don't need to go to my GYN anymore. Not true. Here are the recommendations for cervical cancer screening for women. You start at age 21. Between the ages of 21 and 29, you're getting a pap smear every 3 years. After that age, until about the age of 65, you have choices. You can either continue with a pap smear every 3 years, you can do an HPV test every 5 years, or you can do something called a co-test, which is an HPV and a pap every 5 years. Both the HPV and the pap use cervical cells. It's the same procedure, but they test for different things, and that is obviously done outpatient in the GYN office.
And I just feel like after I've stopped having kids, it's like, oh, I still have to go.
Yeah,
to the
still
OBGYN.
important.
Yeah.
Still important.
Real quick,
Yes.
blood test for Alzheimer's.
Okay, the holy grail. How can we diagnose, especially preclinical, before people develop symptoms? This is a blood test that's been developed by a particular group that showed that it was able to detect with about 80% accuracy via a blood test what we call biological Alzheimer's disease. What does that mean? It's a blood test for something called tau. It's another protein in addition to amyloid, right, that we know can cause or is partly responsible for causing Alzheimer's disease. Why is this test so important? Well, right now, to get diagnosed with Alzheimer's disease, you either go very expensive PET scans, testing of your spinal fluid. It's invasive, it's costly. This is a blood test that you could theoretically do in the doctor's office. Right now, it's not commercially available, but stay tuned. I have a feeling that this is going to be something that we might be able to see. Important. Even if you test positive, doesn't mean you're going to develop. And if you test negative, it doesn't mean that you may not have another type of dementia. But I love this idea that we're moving away from these expensive research only to something that you can actually do in a point of care situation. Always would be followed up, of course, with more confirmatory testing, but great as a screening tool for this debilitating disease.
Breakthroughs today. I know, very, very good. Dr. Azar, as always, thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.